All right, we're going to
All
start over
right,
here. It's Dr.
we're
Sean
here.
Paul. I just want to call. Well, how are you doing tonight in Fort Worth?
Pretty good. I mean, these are weird times. So,
Absolutely.
I mean, I really appreciate your Longhorn football in the background.
Don't you love it? I got the Earl Campbell autograph football here, the Cedric Benson one over here.
Okay.
You know, I got to represent my Longhorn roots. Little known fact, I used to shoot the cannon on the football field at Texas football games. I was a Texas
you?
Cowboy. Yeah,
Okay.
I was a pretty devoted fan.
There's a reason why I'm walking away because
Oh, here we go.
I have to show you something. It's
Let's
important.
see it. We're getting the inside tour of Injector Heather's home here.
This is my home. If I could find it. Okay, so it's really dark in here, so I don't know if this is going to be worth it, but somewhere in here, there it is. Nope, it's not. Anyways, okay, I have a Colt McCoy and Shipley autograph picture.
You love it. I love it. Two Longhorn
Yes.
fans on the other ends of the spectrum. Also,
So, yeah.
little known fact, I used to live in Fort Worth, Texas back in 2009. I lived off a small street called Park Hill Drive near the TCU campus.
Stop! I live
I did-
off Green.
Oh, man. So I did my
Yeah.
internship at what's called the Everything Goes Hospital, John Peter Smith Hospital, where it was a county hospital, kind of wild and kind of wild, wild west. But, you know, I did a lot of very interesting rotations during that year there. And Fort Worth, I'll tell you, is a delightful town. I know it kind of exploded very socially, probably right after I left. And like 7th Street was really like, is kind of built up, is what I've heard. And then,
Exploded.
you know, yeah, I mean, I think it used to just be Billy Bob's and a little bit of the downtown areas where you'd go out to kind of hang out and go to dinners and other things. But I've heard it's just, I mean, of course, people love Dallas, but Fort Worth, if you haven't been there, you have to check it out. I think it's an awesome town.
I mean, I think we're better than Dallas, but I'm partial.
Yeah, I think the average person thinks of the DFW area as Dallas. They don't really know much about Fort Worth. And so I think once you figure it out, there's just a really delightful charm to the town.
Yeah, we're a very small town city, so I appreciate it very much. But yeah, so you're off Park Hill Green Avenue. I mean, we could have been neighbors. So
Probably. So tell us about how long you've been in practice, and you're a nurse practitioner based in Fort Worth. But tell us a bit about your practice, about how long you've been doing aesthetics, and then we already have had a pouring into questions today, so I have them all written down. I'll start to fire them off to you to make it easy for you. And again, we're here with Injector Heather. The goal of this evening is to not think about COVID-19 just for about 30 minutes. Think positivity. I did 2 positive posts, well, 1 semi-positive post, second one really positive post in the last hour about I think power positivity. The power of positivity is so key right now because it's really easy to get down. But tell us a little bit about your practice and about how you got into being, number one, an amazing influence to other injectors and inspiration to younger injectors. My nurses actually are the ones who introduced me to you through social media. You were going to come down and speak at our event, a couple weeks ago.
one day.
It'll happen one day. I don't know when.
Happen.
But tell us a little bit about your practice.
Sure. So yeah, a little bit about me. I've been injecting for a little over 5 years. I became a nurse in 2012, did a couple years in the ER, a couple years in labor and delivery, and then I opened the Browtini Bar, which is my small business, and that specializes in mostly cosmetic tattooing, but we also do soft skincare services, so think like day spa type facials, not too medical focused. But going into that is what got my foot in the door to aesthetics. And I met a physician that was willing to train me on how to inject. The training was kind of subpar, but I really think that for all the aspiring injectors out there, one of the key components to being a good injector is having that artistic eye. So,
Absolutely.
The first training, it's helpful, but if you don't have that artistic eye, I don't feel like you're going to be very successful. So for me, that first training was great, but combined with that artistic ability is what really propelled my career and allowed me to work as successfully as I am today. So since then, I injected at Browtini Bar for a couple of years, and then I transferred into Orange Twist, which is a med spa that's primarily focused out of California. They have a center here in Fort Worth. It's medically directed by Dr. Stephen Camp, and I love them because they allow me to be me. And my style is very natural beauty driven. We're going to talk about my consultation process today, which I think is a little bit more unique than others. Doesn't mean it's for everybody, but it just showcases what I'm about, and it does ruffle a little bit of feathers, but I think that's what's going to be the most exciting part about it.
Yeah, if you don't ruffle little feathers on Instagram, you really don't. People
what
don't
are you
know
even
who
doing?
you are.
Yeah,
Speaking of ruffling feathers, briefly dive into, if you follow her Instagram, and if you aren't following it, make sure you are following it. I see you have a pretty interesting title to your podcast that you put out there. Tell us a little bit about your podcast.
So the podcast, it wasn't supposed to come out until tomorrow, actually, but we did a rush on it for coronavirus because we felt like there was going to be a bigger need for podcasts, seeing as how people were going to be at home more. There were more time on your hands to listen to podcasts, but the podcast is called Sex, Love, and Injectables, and it does ruffle feathers. I wanted to have a podcast where we talked about not just injectables, but also my personal life, because I feel like it's relatable. I feel like it helps people to understand that your life can be messy and that's okay. And, Instagram shows everybody the highlight reel to your life, and it shows how perfect everything is, when in reality, we all struggle through different things. And I want to talk about it because I know I'm not the only one. So we talk about, dating disasters because I'm a divorcee. So we talk about navigating that dating world. We talk about, coronavirus. Even though we weren't going to talk about it, there's things that we can keep lighthearted on that aspect and talk about to help people to get through this time without going absolutely crazy. Talk about dating during the quarantine. So it's a lighthearted perspective on everything life. And
I like how you really engage your followers as well to get feedback. Kind of helps you develop your topics.
Yes.
I saw the one about how someone would date during coronavirus, which is really an interesting topic. I mean, I don't have that problem. I'm happily married, but for people that are, in the dating world, this is, we went from, meeting people out or through friends to bars to things like, eHarmony and then to Tinder and other things. But, this has totally changed everything.
100%. So yeah, it's therapy for me, but also I target it to where it's for the people listening. Because at the end of the day, that's what we're here for. It's not for us. And I talk about that for social media training as well. Your social media is not for you. Yeah, it's fun to post cute pictures, but really you're trying to post for your target audience so that you can grow and create that relatability that everybody is seeking.
Well, let's dive right into your aesthetic consultation and what makes you so different and how you separated yourself in the industry.
So what I focus on is, again, natural beauty. And so we'll just act like somebody just walked through my door. If I have somebody that just walks through my door, after they fill out that paperwork, I sit down with them. And the very first question that I ask everybody that walks through my door is, when you look in the mirror, tell me what facial feature you like the most, which a lot of people are practicing this. I'm hearing this a little bit more lately. But the reason why I do this is not just to find out what their answer is, but I'm also assessing their inside. Because in my opinion, beauty is from within to the outside. There's things you can do on the inside and the outside to make you more confident. So a lot of the times, the funny thing is I'll have people that just kind of stare at me for a while, very awkwardly.
Because we know that most traditional aesthetic physicians or nurses or estheticians will say, what do you not like about yourself?
Yeah, let's get this over with.
What area should we focus on?
Yes, exactly.
I'm guilty of that as well, but I think it's a really interesting
approach. I have those days too. I'm not going to lie to you and tell you that I don't.
Just tell me what you don't like. Just tell me what
exactly. Tell me what you don't like so we can fix it and you can go. So I do that, and a lot of the times they'll look at me like a deer in headlights, and then I'll press even further, and I'll say, no, don't worry about it. I'll say, well, I can continue to look at you, and we can have this awkward staring contest, or you can just tell me something that you just appreciate. And it'll do one of two things. It'll either force them to have an answer, or it'll break them down. And a lot of times that's where your client cries. And then you're like, okay, what's really going on? What life event's going on? It just helps you to assess that whole person, but it also helps you to start your consultation process on a more positive note. If you go in there and you're like, tell me what bugs you, you know, you might, as the provider, be like, okay, I see this, but then I also see this as this. And then your client's going to be like, I didn't even know that that was wrong. And now they walk out with an even bigger complex. And I'm guilty of that too. I'm not going to lie. Yeah. So I'm trying to start that off to be my practice more often, to start there, because I'm assessing everything.
And what are common areas people tell you that they really like about themselves? I think that's a really interesting question. I haven't asked that question before.
The most common thing I get are eyes. I'll get, you know, I like my eyes. And my response is always, you have beautiful whatever you just said, just to give them, you know, affirmation. So eyes, lips, some people will say skin, some people will say my jawline. But it allows me to say, look, the reason why I ask that is because I want to make more emphasis on what makes you feel more confident, but also work, you know, just the things that I know in my training to just build this whole package of rejuvenation and refreshment, and not that reconstructive type of work where we're trying to conform to this social media trend. Because, you know, I mean, jawlines were super popular.
Yep.
Cut jawlines can look really good on some people. Cut jawlines can look really bad on some people.
Yep.
You know, so it just helps to take away from that trendy thing and just make it more customized and personalized to your client. But it also helps you to introduce the idea of, okay, a little bit about myself. I'm more natural beauty driven, so I'm going to make you feel more rejuvenated and more refreshed, and again, not reconstructed. So I start there, and then I also, this is where it ruffles the feathers, okay? And you might even be like, absolutely not, this is absurd.
Hit me with your best shot. Let's hear it.
All right, so I will never tell my client that I want to shave off ears. I'll never tell them that the goal is to make them appear younger. For me, at 34 years old, obviously I'm not 50, I'm not 60. But I will never tell a woman that I want to make them appear younger. I want them to be proud of their age. I want them to you know, hold that with pride because they earned it. But I want them to feel like a 50-year-old J-Lo and not a 50-year-old, you know, smoker crackhead. That's so offensive. But my thing is, you know, I think society really makes women feel valued based on their age. The older that women get, the less valued they may appear or seem.
I think that's a really intelligent approach to a very sensitive topic. I know that, you know, patients that come to me are looking for an eyelid lift or a face lift or something along those lines. And so some of those patients, you know, they respond well to that. I know that some of the patients don't respond well to the topic of age, but I think you know, having a tangible goal of just looking better about how you feel about yourself really treats your patient from within.
Yes.
And again, you and I both know this, and in the industry right now, you know, people can love you one week and then, you know, 3 months later they're not seeing you back, or they get a special on Instagram or a special online that they see and they'll go somewhere else. They'll come back to you again, but that emotional connection, whether you're their family practice physician or you're their dentist, you know, as your aesthetic provider to them, I mean, you can really maintain that relationship if you have emotional connection to them.
Absolutely. So, I mean, I think ultimately you're really just trying to establish trust with your patient. And I tell them, you know, I want to see you from today onwards until you feel like you don't need aesthetic treatment anymore, which should be, you know, never, because you see everybody from, you know, 35 and even younger to.
What's the youngest client that you've had come in your practice?
Probably 20. And I'm not going to lie. Like, I talk about natural beauty driven. I have a 19-year-old that I've done her lips. But I used Bobella, half syringe, because I didn't want her to go somewhere else.
Yeah.
So, you know, the younger people I treat with caution. I really make sure that they're not trying to look like somebody that they're not, and they don't have unrealistic expectations. But if it's a 20-year-old that's blonde, that's sunbathed, and she has, you know, genetically thin lips, I don't see a problem with giving her some lip filler if it makes sense.
Absolutely. And also, I think one thing I've learned through your Instagram as well is, whether it's jawline or lips or, just basically skincare, sometimes people may think it's one thing, but in actuality, it's something else on that facial harmony. I think that's why I like your approach to a complete aesthetic evaluation. Talk to me about, skincare is all over the place. You see providers that are working with companies who have their own skincare line, and then you and I both know we'll still have that patient that comes in and you're like, well, what do you do for your maintenance? They're like, well, soap and water and maybe some oil of Olay. They don't know what they do. What are some essentials you think that, especially now in this time, whenever you're not able to get out, you're not able to shop like you normally do, maybe through Amazon or online, but like what are some essentials people should be using when it comes to skincare?
So I think the best way to approach this is just to talk about the anti-aging approach that I take just in general. I do a 4-prong approach. Number one includes Botox. We don't talk about this because that could be a whole nother conversation, but number one, Botox. Number 2, replacing volume that's been lost. Number 3, collagen. And number 4, skincare. And it's not a stepwise approach. As you know, this is all interchangeable. But with skincare, I really urge everybody to get on a medical grade skincare regimen because it's proven by science, by scientific research, medically backed. So, it's unique times for like this time period on what you can get. I don't recommend you get anything from Amazon. I don't care how many ratings it has or how many 5-star ratings it has. I just would not. You don't know where it's coming from. I know a lot of places like I don't know if Emily Rockwell is doing deliveries anymore for not established or new clientele, but there's a lot of places that will do virtual consultations now and take a look at your skin, ask you some questions, and then they'll formulate a regimen for you to ship out to your door. I think that medical grade is extremely important, and this is coming from somebody that was extremely skeptical of medical grade skincare lines. I was like, it's too expensive, it's just skincare, it's not going to do anything. But once I started really committing to using Zeo, which I think a lot of lines are great, but this is the one that I chose, my skin has changed tremendously. So as far as the most important components, I think vitamin C is important for everybody. Retinol is extremely important, but everybody's different. Bottom line, what doesn't change, sunscreen. I don't care if you're, white as can be or, African-American dark skin, sunscreen for everybody. And not the sunscreen that's in your makeup, actual SPF, at least 35, and applied every couple of hours.
Awesome. So take us back to your consultation process again. So you've talked to the patient a little bit about what areas they like themselves. You're beginning to talk about that approach. Walk us through the next steps on how it works with your clients. Are they getting treatments with you that day? Are they planning things out? How do you map out their aesthetic plan?
Sure. So the next step for me is your traditional question. And I word it not what do you hate, what's wrong with you. My question is what bothers you the most when you look in the mirror? There's a couple different components to this. So if it's a 20 to 30-year-old that says I have thin lips, enough said. We don't need to talk any further. Let's talk lip filler or skincare. If it's somebody that's over 30, that's when we begin to see some fat loss or some volume loss. That's when we start to see aging taking place. So I offer a full face consultation to everybody at that point, and I think that injectors would have a lot easier of a position if they did this as well, because we get a lot of people that'll say, oh, I don't like my tear troughs. Well, if you're over 30, I'm not going to do your tear troughs unless you've had your mid-face done. So, at Orange Twist, we weren't privileged to have the face on our consultation sheet, so I'd actually draw the face and then put it into thirds and talk about how we have a shift of the facial fat pads, we have a loss of volume, but ultimately fixing the foundation of the house, if you will, which is your mid-face and supporting the fat pads, is what you want to start with first, and then you can add the curtains to the house, aka the tear troughs, lip filler, all of that. So I offer a full face consultation to everybody, and that includes that 4-prong anti-aging approach. Botox number 1, volume number 2, and then collagen induction number 3. So yes, we typically do leave enough time for treatment because we are I want it, I need it now type of society. Typically it doesn't take too long to do cheeks if they haven't had it done before.
When patients are coming in and like you can't get them to their aesthetic goals, when are you thinking about surgical things to offer them, or like to send them to, I guess Dr. Camp is one of your physicians there that you work with. When do you get to that level where you're like, listen, I can't help you?
So to keep this as lighthearted as possible, I am not Jesus. I cannot perform miracles. There's a lot of things that you can do with filler and Botox, but I think it depends on that person. If they are, in their 50s and they've never done filler before and they've never done Botox before and they have a very severe level of laxity and they're doing this move, I just want to look like this. Filler is not going to do that. So I am not one of those places that will take your money. And I know we'll all say this, sure. But truly, I want to build a relationship with each person that comes through my door. So if it's not going to meet those expectations, you have to at least do some surgical consults. If you're somebody that says, I'll never do surgery, then I'll let you know 30% improvement.
Yep.
But if you manage your client's expectations from that consultation, you'll have less of a headache at the end.
And there's some patients that are just simply afraid of surgery. I mean, we have those all the time that come in our practice, come in for something they think is surgical, and they're like, I just don't want to deal with the scar. I don't want to deal with the downtime. And I think this is where, this gap patient or patient who's not ready for something surgical but wants something surgical, like they'll be accepting of something that's 30 to 50% improvement in those areas.
Well, and that's why I was so curious about, the procedures that you're offering down there where it's done under local, correct?
Yeah, so we I think, I'm one of the researchers and instructors for some of the radiofrequency skin technology called through InMode. Morpheus 8 is our radiofrequency treatment that tightens skin. It can offer subtle lifting of the brow or subtle tightening of the rhidids around, or the wrinkles around the skin on the eyelids and the face and the neck and the décolleté, even improve stretch marks or stretch marks on your stomach, on your legs. I mean, these are things that have totally changed the game for us when it comes to surgical consultations, because basically it was three options. It was do nothing, it was do minimally invasive things like fillers and toxins, and then it was surgery. But to fill that gap in between in a stepwise process, it goes from injectables to surgery now, and now put in something that can produce surgical type results. It's been quite amazing. I think the two areas I focus on the most are people who have either had injectables, they kind of want to try something different now. So they have so I have a good relationship with a lot of the injectors here locally, as well as in San Antonio, Dallas, and Houston.
Right.
And these are patients that still don't want to be put under general anesthesia, and so we offer them what's called face tight, which is a tightening procedure of the jawline here. And it actually heats the tissue through a bipolar radiofrequency, which means there's a probe under the skin and above the skin, heats the tissue under local anesthesia in the office, and it provides about 30 to 50% improvement of the jawline or the area in the submental area. So, we have some injectables that are out there that need to be repeated and take time to shrink this area. You're talking about a one treatment thing essentially for permanent results. And they've even showed, patients that lose weight over time can still get maintenance of those results. So it's a longer lasting procedure. It's still, but if you have someone who's, in their 60s or 70s and has a lot of skin laxity, they need skin excisions. You can't really get away from that. And for the eyelids in particular, I'm sure you see this all the time too. There's a lot of people, and in the comments I've seen quite a bunch of notes about, injectables under the eyes done before you fill the cheek, and then you run into problems where you have visible filler or you have prolonged swelling. There's kind of becoming a trend toward, let's see if there's another option in this area. And we're finding that with subtle heating of that tissue, yes, you're going to have a little bit of swelling, but you're going to get that tightening that you really want. Now, for the tear trough area in particular, I think that you really need to do a filler type treatment to tighten that area. When you just have the bulge underneath the eye that's kind of hanging over like a beer belly hanging over a belt, if you can just tighten that area, just as you had mentioned, if you can give people a subtle approach that's different, that's in the office without invasive surgery, they're very happy. Of course, for us, this has actually increased both our surgical volume and this volume of this treatment as well, because some patients, frankly, need a lower lid blepharoplasty, and you need to move that fat down to the tear trough there to give them what's so-called, like a permanent tear trough fill. But a lot of patients don't want surgery. They don't want anesthesia. They don't want to feel like they have the surgical downtime. They don't mind swelling. And, you might have some bruising, which you can have with any cosmetic treatment. But what they don't want is they don't want to, they're afraid of the scalpel or they're afraid of sutures. And I think that's why it's worked really well. I actually got into, I purchased the device. I wasn't even part of the training team that did that, did the research, but then I had a very high volume of eyelid surgery when it came to brow lifting, upper lids, lower lids. And so I wanted to really focus on jawline and neck, and we've been able to kind of enhance both areas. It works really well in conjunction with some surgical procedures, also in conjunction with some fillers as well. So we kind of use a combination treatment.
And I think that's the name of the game for everything aesthetics. It's always about combination. And just to touch on that, the issue of bruising and swelling, I will just, for all the injectors that are going to listen to this now and later, never ever tell your patient that they may not swell that bad. Just from experience, I've learned that if you say that, it's going to be on the patient that swells the worst. So and a lot of people will be afraid to do this approach, but even when I'm doing lips, I'll tell my client, expect the worst and expect that on day 2 you might question why you did this. Totally normal. That's just because the lips tend to swell more than anything else. So just a general random rule that I've come to live by, as well as that I never inject a tear trough unless I do their mid-face first if they're over the age of 30.
We had a question that came in. We've been chit-chatting a ton about your consultation process, but also want to get to some of the questions here as well.
Sure.
What's your preferred approach to lines in the perioral area? And they said, do you prefer toxin, do you prefer filler, or do you prefer resurfacing in that area? And that's for basically fine lines around the lip. Probably for your smoker lines is what they're asking.
Yeah.
There.
So I think I used to love toxin in that area, but I think that and people complain more about toxin in that area than anywhere else because it affects your ability to speak. It affects your ability to use a straw. I've done it to myself.
And they come in kind of looking frozen like this, and they don't. Yeah,
well, it just doesn't move, and so then they try to drink, and it just like I've done it to myself where I put too much in there, and it's not a cute look. So, and because we move this area so much, it metabolizes out quicker. So you're talking about a procedure that has to be redone.
It's a low bang for your buck. It's not very expensive to do, but then the results are variable. Some people look great, some people aren't happy.
Exactly.
I understand that. Yeah.
So I think the best approach for that is filler and resurfacing. I don't think one or the other. I think you can get great results by doing one or the other, but you can get even better results by doing both.
Next question was about brow lifting. Do you use toxin, do you use threads, or do you use filler to make the brow subtly lifted is what the question was.
Brow lifts and Botox are like my battle every day with clients because, they think that the more Botox you get, the more of a lift you'll get, when in actuality, if you're dealing with the frontalis muscle, as you know, the more Botox you get, the more likelihood that you're going to drop the brow. Yep. But if you get closer to this orbicularis oculi, you can lift it. The trick is you have to hit that muscle. Yep. And some people have an issue with that. So personally,
I'll tell you how I approach it. Do you hit it above, below, outside? Which area do you like?
I go right into the brow to try to hit that. I don't go anywhere above it. And I try to pull it up because I feel like there's likelihood of hitting that frontalis muscle.
So if you want to know my approach, I will lift it up and just place about 2 to 4 units here.
Perfect, yeah.
And so from an oculoplastic standpoint, which is my specialty, I know if I can relax your orbicularis oculi, which is the sphincter muscle around the eyelid, yes, you're going to weaken the closure slightly, but you're going to lift it up. Now you have to be careful though, because Heather made a good point about injecting on the frontalis muscle. Some patients will come in and they're looking very Spock-like, so you still want to not forget about the frontalis, but not over-treat that area.
So that's a good question for me to hit back to you. So with my first-timers for Botox, or with just a first-timer for me, let's say they've gotten Botox before, I tend to go lighter on the frontalis because you can always add as you go. But what do you do to prevent the Spock brow? Because I usually just tell my people, if you do get a Spock brow, just come see me, just in case.
I prepare them for a 2-step injection. I say, this is going to be a step 1. We're going to treat the area around the eyes. I'll see you back in about 10 to 14 days, and we're going to touch up everything here, and that's going to give me an assessment on how we're going to map your plan out for the next year. For me, setting them up for the understanding that it's going to be something I want to see how they assess, because like you said, the anatomy varies in the area. The way you'll lose the patient forever is over injecting the forehead. Because then all of a sudden, it doesn't matter if you're 25 or 65. If you drop their brow, you won't hear the end of it. And also, you've lost that patient. Yeah. So I prepare them for a two-step process initially. And I say, listen, first consultation, we'll do step 1 here. I treat very light. I have my nurses who inject as well. I'll draw a 50-yard line across the forehead. I'll inject higher up. But if they have very prominent rhytids here, I will ask them, I'm like, listen, are you okay with this? I push it down even further than it's going to be. And they're like, oh, I don't mind at all. I'm like, listen, I can do a tiny, tiny bit here, but you can feel the heaviness. If you don't want it, what we'll do is we'll inject above, and we'll come back and we'll touch up only slightly if you need it.
Exactly, because then you get the person that has that one line right there, and they're like, but now I have this line.
Exactly. And you and I both know it's like if you don't set them up for that possibility, you're going to be frowned upon very quickly, and potentially, and they'll go to the place next door, or they'll go to a physician. If you're a nurse, they'll go to someone else. Well, this person injected me and they didn't know what they were doing. I'm like, listen, no one's anatomy is the same. We're all doing our best. We're all in it together, and we're trying to make sure you have great results. So I think first-time clients, the key thing is do a two-step approach, and I say a two-visit approach, and then at least they understand. And soon, and you can text them, say, hey, if you're starting to look higher sooner, then just come in and see me quicker than.
Basically, I tell them, if your eyebrow goes to Jesus, just let me know. It's a quick 1 to 2 unit fix.
Absolutely.
And then I saw somebody had commented, so real quick, for wide jawlines, and you can chime in on this because I don't know what your take is, but if I have somebody that comes in and they tell me that they want to slim their face with masseter injections, I tend to not do it unless it's causing them pain, because unless they're like a square face, sometimes you want to keep that because it helps to sharpen the jawline, but also all of this is holding up the structure of this. So if you're thinning out that masseter muscle, you're not supporting up here. And you can chime in on that. That's my approach. I think it's an Instagram trendy thing that people were wanting to slim the face, but not for everybody.
I think you have to really understand if they want skin tightening, which is this. And in that case, I use most extreme approach is facelift. Secondarily, it's radiofrequency skin tightening because they're not getting filler, but you're leaving that natural volume there, which is good. If you really have someone who has prominent chubby cheeks in this area, then I do recommend a little bit of masseter injection, and that just slims that area. They have to be prepared, though, that if they have any laxity of the skin at all in this area, or if they have redundancy of this fold, basically in the marionette line, if you don't address the chin number 1 and then this area number 2 with filler or some other option in that area, they're going to see that more redundancy, or if they lose weight. But I will tell them that if you can do some of the skin tightening, you can actually decrease the amount of filler you need as well. And so I like that. Again, this is something I added to my practice about a year or so ago. It's totally changed the way I approach it. The cost is higher though, so still sometimes you end up choosing between filler and toxin, and so I'm very selective. If you have someone who's really aged, you don't want to forget about the buccal fat pad as well. That could be also in that area. So we do offer buccal fat pad removal, and also some of the that's more of an invasive thing you'd want to do. I think that it's usually subtle results when you talk about masseter jawline. So it's really popular in Korea, where Korean patients have much stronger, tighter masseter muscles. And you're right. If you have a clenching issue, that's really it can be helped, in a little higher area here for TMJ. So I think you have to be very selective. You're talking 25 to even up to 40 units on each side if you're doing those treatments. So this can be quite costly as well, and you need to repeat those treatments at least a sequence of 2. Usually I do about 2 to 3 months apart, and then potentially that can decrease the size of that muscle. But the patients who love it. Other patients are okay about it, but you have to commit to at least 2 treatments.
It's very subtle.
Yeah. Another question we had about is what do you enjoy about your job the most?
That's a great question. So I think for me, I love the ability to instill confidence in my patients. This position, especially coming from an emergency room background, as an emergency room nurse, I enjoyed being able to save lives and make a difference in people's lives. And then when you go to the med spa arena, to some people, they feel like it's more superficial until you step into those shoes and you realize those patients. I mean, I've had people cry tears of joy after getting injections because they finally did something for themselves that made them feel more confident. And you've had this patient, the one that walks in where they're, wearing sweatpants and they're disheveled and no makeup and just, not very excited to be there. And then for their follow-up appointment, they're dressed to the nines, they have makeup, and they're just walking in with this like whole new confidence. That, my whole thing is I'm a very empathetic person, probably more empath than anything. I love the idea of being able to make somebody feel better about themselves, because I think that you treat everything else in your life better. You're a better mom, you're a better wife, you're a better girlfriend, coworker when you feel happy with yourself. When you're sad, it's just kind of like, what's the point? So yeah. That's what I enjoy. And you get to be creative.
Yeah. And then I can't believe we've been talking for 40 minutes. We just have two more quick questions here. And then again, we're with Injector Heather. I'm learning a ton of stuff about her consultation process. Another question that we had that I think that was really interesting is, if you're going to pick one area to treat first, if you haven't gotten an injection before, what are good areas that you kind of focus on with those new patients?
Number one, Botox. There's no substitute for Botox. And, if you treat this area, you're treating your worry lines. If you treat this area, you're treating anger. Treat the negative lines first. Second thing, filler mid-face, because you're going to get more result all over versus anywhere else.
Fantastic. And our last question is what are the trends that you see happening in the last 12 months? You think that'll stick around?
The trends that'll stick around, I think, is more of an approach to feeling more beautiful with less makeup, feeling more beautiful with that natural beauty versus the overly done makeup, the overly done Instagram everything, the 10 layers of makeup. I think that the trend that's going to stay around is just women feeling more confident with less.
I love that. So if you want to hear more from Heather, I think you should check out her podcast. It's amazing. I think that it's so cool to have someone. No judgment, but also I think it's nice to have someone in my industry who's really just expressing themselves so uniquely and also very honestly about their approach. I think the emotional connection she's showing with her patients is awesome. And then secondly, ideaAUSTIN, the event, we will hopefully have a date very soon. We're just waiting for everything to kind of slowly open back up. And we're looking for this fall as our potential rescheduled date. And I think everybody should hope everybody just stays safe, stays healthy. And Heather, thanks so much for joining us this evening and taking a break from your. Actually, one more quick question before I forget. So it says, sure. As we get older, skin gets fine. How do we keep it looking thick? That's a great question from an aesthetic provider. How do we keep it from
looking thick?
No, how do we keep it looking thick if you have thinning skin?
Okay, so keep it looking thick. That's going to be collagen induction. So go see Dr. Sean. go get skin. So anything that's going to induce collagen is going to help to keep that skin strong. And collagen is your bounce back to the skin. So if you're not addressing collagen early on in your 30s and 40s, you're going to have a rougher time in your 50s and 60s. So if you start earlier for that preventative care.
What she's talking about is, again, heat. Basically, it's just heat to the skin, treating the layers from epidermis, dermis, subcutaneous fat, even as deep, sometimes as deeper fat in other areas in the body. And a lot of our patients, let's say you've had a baby or you gained weight or lost weight and you have a little bit of loose skin, I think that it's really nice just to tighten the skin without a tummy tuck, without an arm lift, without a thigh lift, without an eye lift, without a facelift. And these technologies were available. They've been around forever, but the company, and there's a lot of choices out there, but using safe technology to me is much more important because it's still my reputation by the end of the day. And I want to make sure I'm delivering something that I can believe in. And, those results really kick in over time. So everything that, Heather does when it comes to toxins and filler, as well as the skincare, those are things you can continue to maintain. But if you can give your skin that extra boost, and you can really change just the entire texture of that skin. It's hard to thicken the areas, particularly like in the décolleté and the neck. Those are areas you can really see some aging changes, and those are some of our happiest patients who've just had this area treated here, so they can wear a shirt that they can show that area off, and you can just see tighter skin. But I think that's the only way I really found to thicken skin appropriately. And the way that works histologically, to get more scientific, is you're heating the tissue, you're causing a thermal damage to the tissue, and then it's rebuilding new collagens. Instead of aged collagen, you have thicker, plumper collagen. But you have to maintain it and still treat other areas such as toxins to improve the musculature, make sure it still looks tight, and fillers. So you can't just you can do the Morpheus, or Morpheus is the name of the treatment. That's the fractionated radiofrequency needling. So if you've heard of like skin pen or microneedling, it's the same type of thing, but with the heat going down to the different layers of the skin and producing neocollagenesis, which is tightening of the skin. But I think also you still have to maintain a good skincare line. You can't be out in the sun and just letting your skin wilt away. You can't do those things and have good results. In fact, if you do that, your skin's just going to continue to accelerate. I think it's in the aging process. And so I think radiofrequency turns the clock back, but doesn't necessarily reset to 10 years. I don't like to give that promise to my patients. I'm like, I do like to tell them this is a nice way to slow down the aging process in your skin.
Slow it down, exactly.
And just find particular areas that bother you. For example, we've had patients who've done it on their face and their neck, and they're pretty happy after 1 or 2 treatments. I think everybody varies. Some people do really well after 1. Some people do better after 3. Depends how much, if they have acne scarring, if they have really loose skin, depends on how much damage they have. But secondarily, like I mentioned earlier, let's say you have a stretch mark, or you have arms that really want to be tightened, and you don't want to do something surgical. That's where you can offer those things. And I'm not a body plastics person, but my aesthetic nurses in my practice use those treatments all the time. And I think that heat's good. You also have other treatments as well, but I think heat really, to me, makes sense from a histologic standpoint, not too scientific.
And for the people that ask, when should I start these treatments? My answer is, if you are somebody that says, I don't think I need anything yet, start doing those treatments, because that is what's going to help to slow down that aging clock. And you can correct me if I'm wrong, but if you have a lot of collagen, don't you get better results with these treatments versus if you don't have much? It's hard to rebuild something that you don't have.
Yeah, basically, that's why I think it really works well in that sweet spot between 25 and 55. Those patients have good collagen, and we cover all of Central Texas. All patients who work out in the farm and they work out in the country, they come in, their skin's really beat down, they don't have great skin. Those patients aren't good candidates for it, because they're not going to take care of it. They're going to go back out there, and also they're prone to kind of actually have a more inflammatory response after treatments like that, because you already have really inflamed skin. So I send them back to people who are like dermatologists or nurses who focus on skincare, or my own team that focuses on skincare, and say, listen, get your skin in order first, get your skin looking better. And like some of the basics we talked about, retinol, sunscreen, if you're not doing the basics, you really aren't a good candidate for some of these other treatments. And so I think you want a gentle treatment. You want to feel good about it. You don't want to have problems. So I'm quick to turn people down if I know they're not going to be compliant with these treatments.
If you don't use sunscreen, I'm like, what is the point? And the sunscreen in your makeup does not count. So, it's always a multifactorial approach for anything that you look at aesthetics. There's never a one-time treatment. It's about finding a provider that's going to help to lay out that treatment in a more simplified way that respects budget and respects what your goals are, but it's also going to tell you no. Like if you have somebody that has ginormous lips, no more lip filler. Let's do something that's going to be more beneficial for you.
Yeah, and I think that's why it's so important to do a team approach, and really, Heather does a ton of injections and she does a ton of toxins. So if I know that someone really needs that added care, I send my patients to someone like her or the nurses in my practice. And if she's like, I know doctors that do surgery that specialize in this area, go to someone who does a lot of something. Like by the end of the day, it's your face. And so, I personally don't do rhinoplasty surgery. So if I know someone really wants to focus on their nose, I send them to someone who only does noses, because you want to go to that person who focuses super specialist. Yes. I think there's maybe 3 or 5 oculoplastics doctors on Instagram that really talk about oculoplastic stuff all the time. And so people come to us because we really try to advocate that we're specialists in that area. But I'm not talking about breast augmentation. I'm not talking about rhinoplasty. That's not even out of, but I'm happy to, you know, get you to someone who really does something great. And so, I do tons of injections all the time in practice, but I also have two amazing nurses who I'm happy that if the patients trusted me, that they've had their blepharoplasty with me or another treatment with me, I'm like, listen, like I've worked with these nurses. They do exactly like the way I do it, but they just do a lot, and they can walk you through it. And they also can spend the time that you need to kind of make sure you get the right maintenance program. I think that's the key. And that to me is a complete aesthetic team, which I think is, and you know this, there's providers out there who want to be the best at everything or want to do every treatment, and sometimes that's just not the best for your patient. So remember, there's a human being on the other side of that, on the other side of the chair. So
yeah, no, I will never be good at, doing facials. I'm not going to do massage. Like, I'm very passionate about injections. And on the other side of it, that's one of the reasons why I am a nurse practitioner in aesthetics and do injectables. I would not be very passionate about surgery. There's just certain things that, and like another example, I would never be good at eyelash extensions. There's that meticulous work that I would not, I'm way too OCD ADD for that. Injections, give it to me all day. So yeah, it's about, doing the patient, doing their research, finding somebody that is focused primarily on the goal that you have. And then also the provider knowing their limitations and feeling comfortable enough to punt those people to the right people without fear that they won't come back, because they will.
Absolutely.
They respect you more for it.
Yeah, and also you get more friends out of it. I mean, I've learned so much from you. I've learned so much from,